Hello everyone, this presentation will cover the pharmacology for Meloxicam, a new drug approved for fireline paramedics at Reno Fire Department. Meloxicam belongs to a class of medications called non-steroidal anti-inflammatory drugs. This class includes well-known medications such as aspirin and ibuprofen. Meloxicam inhibits enzymes known as cyclooxygenase or COX. There are two versions of this enzyme, COX-1 and COX-2. COX-1 protects the lining of your stomach from irritants and helps with kidney function and blood clotting. COX-2 is activated when joints become injured or inflamed. Whereas ibuprofen inhibits both COX-1 and COX-2, Meloxicam selectively inhibits COX-2 and to a lesser extent COX-1. For this reason, it is believed to be less harmful to your GI system and more targeted to decrease inflammation and pain involved with joint injuries. These enzymes are necessary for the normal production of prostaglandins, which play a role in causing inflammation, pain, and fever in the body. By inhibiting these enzymes, prostaglandins are no longer produced, thereby reducing these effects on the body. Meloxicam was traditionally prescribed for various forms of arthritis. It is also commonly prescribed as an anti-inflammatory for acute musculoskeletal injury, including sprains, strains, and dislocations. This is what we will be using it for. Meloxicam is contraindicated in those with known hypersensitivity to meloxicam or other NSAIDs and asthma secondary to NSAID use. Use with caution in patients with pre-existing peptic ulcer disease, GI bleeding, or associated risk factors, as these can worsen while using meloxicam. Do not give in the setting of post-operative cardiac surgery, such as coronary artery bypass grafts or any other major vascular surgeries. Use with caution in patients with multi-system trauma, possible head injury, and possible intra-abdominal injury. Those with liver or kidney disease may affect drug metabolism and excretion, so use caution in these patients as well. Meloxicam should be avoided in women as early as 20 weeks gestation. Administration can cause premature closure of fetal heart ducts and fetal renal dysfunction. Lastly, do not give to children less than 12 years of age. Common side effects for meloxicam are similar to other NSAIDs and include gastric irritation, diarrhea, nausea, abdominal pain, dizziness, tinnitus, fever, and flu-like symptoms. Serious complications include GI bleeding, ulcers, and perforation. NSAIDs have also been shown to increase the risk of MI and CVA. Other serious complications may include hypertension, CHF, nephrotoxicity, hyperkalemia, hyponatremia, hepatotoxicity, and bronchospasm. Our dose for meloxicam is 15 milligrams taken orally once daily. Do not administer more than 15 milligrams in a 24-hour period. This is the max daily dose for an average adult. Its onset is about 30 minutes to an hour, reaching a peak onset of about 5 to 6 hours. Its duration is about 24 hours, hence the once daily dose. If you think about it, taking 15 milligrams of meloxicam is equivalent to taking 2,400 milligrams of ibuprofen over the same time period if you were taking 600 milligrams every 6 hours, which is often the case. This picture is the exact formulation that will be supplied in the Fireline medic bags and will be clearly labeled, distinguishing it from other oral meds. Unlike aspirin and other NSAIDs, meloxicam has no effect on the blood clotting mechanism, making it an ideal medication for the austere environment with possible trauma. Using meloxicam with other NSAIDs significantly increases the risk of associated GI complications and should be avoided. Make sure to ask all patients about current medications they're taking, both prescribed and non-prescribed, with an emphasis on over-the-counter NSAID use. Meloxicam may not adequately control one's pain by itself. Consider supplementing with Tylenol using its usual dose. Tylenol is relatively safe as it is not an NSAID and also does not affect coagulation. Lastly, meloxicam should be reserved for line personnel only who are under direct and constant supervision. Meloxicam is a prescription medication and should not be given to patients likely to be discharged without further monitoring. We would like to leave you with some additional resources regarding this new medication. Meloxicam has been added to the regional protocol app under our agency appendix. In addition, Meloxicam and Tylenol are medications outlined in the Tactical Combat Casualty Care Guidelines. These are referenced as the standard of care in tactical and austere environments such as in the military. In addition, you may reference any of the following sites to learn more about this medication. As a reminder, all paramedics must complete this training with associated quiz on target solutions before being permitted to administer Meloxicam in the field. And that's it. Thank you for your time.